Eating disorders, meaning, symptoms, causes, and treatments. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. Eating disorders, meaning, symptoms, causes and treatments are discussed in this video. Now, let us start. What is an eating disorder? Eating disorders are serious mental illnesses affecting people of all ages, genders, ethnicities, and backgrounds. People with eating disorders use disordered eating behavior to cope with difficult situations or feelings. This behavior can include limiting the amount of food eaten, eating very large quantities of food at once, getting rid of the food eaten through unhealthy means, for example, making themselves sick, misusing laxatives, fasting, or excessive exercise, or a combination of these behaviors. Eating disorders are serious mental illnesses. They can affect people of all age groups, genders, backgrounds, and cultures. The number of people with eating disorders is increasing. We understand more about eating disorders now than ever before. Yet, many people live with these disorders for a long time without a clinical diagnosis or treatment. Female adolescents and young women are most commonly diagnosed with an eating disorder. Males and gender-diverse people also experience eating disorders and are often underdiagnosed. The most common risk factors for the onset of an eating disorder are body dissatisfaction, dieting, and depression. Symptoms of eating disorders. There are some warning signs that are common to people with eating disorders. These may include weight loss, weight gain or weight fluctuation, usually due to dieting, but sometimes from an illness or stressful situation. Preoccupation with body appearance or weight. Sensitivity to cold. Faintness, dizziness, and fatigue. Increased mood changes and irritability. Social withdrawal. Anxiety or depression. Inability to think rationally or concentrate. Increased interest in preparing food for others. Obsessive rituals, such as only drinking out of a certain cup. Eating in secret. Wearing baggy clothes or changes in clothing style. Excessive or fluctuating exercise patterns. Avoidance of social situations involving food. Frequent excuses not to eat. Disappearance of large amounts of food from the refrigerator or pantry. Trips to the bathroom after meals, and constant and excessive dieting. 4 main types of eating disorders. The main types of an eating disorder include 1. Anorexia nervosa, characterized by restricted eating, weight loss, and fear of gaining weight. 2. Bulimia nervosa, periods of binge eating, often in secret, followed by attempts to compensate with excessive exercise, vomiting, or periods of strict dieting. Binge eating is often accompanied by feelings of shame and being out of control. 3. Binge eating disorder, characterized by recurrent periods of binge eating. Binge eating can include eating much more than usual, eating until uncomfortably full, and eating large amounts when not feeling hungry. Feelings of guilt, disgust and depression can follow binge eating episodes. Binge eating does not involve compensatory behaviors, such as bulimia nervosa. 4. Other specified feeding or eating disorder, OSFD, feeding or eating behaviors that cause the individual distress and impairment, but do not meet the criteria for the first 3 eating disorders. Causes of eating disorders. There is no single cause of eating disorders, but the combination of factors can lead to an eating disorder. Social, psychological, and biological factors all play a part, in varying degrees, for different people. Let us consider these factors one after the other. Social factors. Social factors contributing to an eating disorder include media and other presentations of the ideal body shape as lean and fit, pressure to achieve and succeed, peer pressure to be or behave in a certain way, a cultural tendency to judge people by their appearance, and occupations or activities that emphasize a particular body shape and size, for example, ballet, modeling, gymnastics, and elite sports. Major life changes or events may also contribute to the onset of an eating disorder, including relationship breakdowns, pregnancy and childbirth, and the death of a loved one. Eating disorders can also be triggered by the accumulation of many minor stressors such as fear of the responsibilities of adulthood, a belief that love is dependent on high achievement, and poor communication between family members. Biological factors. Biological factors contributing biological factors may include adolescence and its associated physical changes, and genetic or familial factors, for example, families that are overly focused on food, weight, shape, and appearance. Psychological factors. Psychological factors contributing psychological factors may include low self-esteem, negative body image, perfectionism, depression, anxiety, impulsivity, obsessive thinking, and difficulties expressing emotions. How to know if a person has an eating disorder? Many people have problems with their eating. If you do have an eating disorder, it is important to seek help. Remember that with support from health professionals, eating disorders can be recovered. Getting professional help and support from others is important. Recovery may be slow as you learn to approach food in a more positive way and understand the reasons for your behavior, but the effort will be worthwhile. Family and friends of someone with an eating disorder. Parents, siblings, partners, friends, extended family, work colleagues and others often experience many different feelings as they learn to cope with the effects of an eating disorder on the person, and on their own lives. The strain of living with an eating disorder can create tensions and divisions within a family. There may be feelings of confusion, grief, anger, guilt, and fear. Family and friends can remind their loved ones that the effort associated with recovery will be worthwhile for everyone. The most important thing is to show love, care, and faith in the person, and seek advice at the earliest possible time. Some suggestions for family and friends include 1. Be honest and open about your concerns. 2. Use I statements rather than you statements. For example, say I am concerned for you because I have noticed you don't seem happy at the moment rather than, you aren't happy at the moment. 3. Focus on the person's behavior, rather than their weight, food consumption or physical appearance. 4. Try to take the focus off food and weight. The person with the eating disorder is already likely to be excessively focused on food and weight issues. 5. Mealtimes should not be a battleground. Frustrations and emotions need to be expressed but not at mealtimes, which are already likely to be difficult. 6. As much as possible, do things as you usually would. The person with the eating disorder needs to learn to coexist with food and other people, rather than others learning to coexist with the eating disorder. Treatment and recovery for people with eating disorders. Many different forms of therapy are available. It is important to remember that different approaches work for different people. Finding the right approach and early intervention maximizes prospects of recovery. Professional help and support from others are important. Because eating disorders affect people physically and mentally, many health professionals might be involved in treatment, including psychiatrists, psychologists, general practices or doctors, dietitians, social workers, nurses, and dentists. Conclusion. Eating disorders, meaning, symptoms, causes and treatments have been discussed in this video. Eating disorders are serious mental illnesses affecting people of all ages, genders, ethnicities, and backgrounds. People with eating disorders use disordered eating behavior to cope with difficult situations or feelings. There is no single cause of eating disorders. Body dissatisfaction, dieting, and depression are common risk factors for the onset of an eating disorder. Eating disorders can be overcome with professional help and support from family and peers. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, then give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.